Good afternoon, everyone. Welcome to LivingWorks Live, another edition coming at you today. And I'm joined by Sergeant First Class Chris Allen. He's with the South Carolina National Guard. How you doing, Chris?
I'm doing great. How are you?
I'm excellent. Looks like a beautiful day there, a little bit windy, so we're going to hop right to it. Listen, we want to talk today a little bit about how the National Guard in South Carolina and really across the U.S., but in particular your division, how are you guys responding to the COVID-19 crisis?
So we brought on several hundred folks around the state. Our main mission right now is getting the protective equipment to first responders, medical personnel throughout the state. So the masks, the face shields, the gloves, the paper suits that they wear when they examine. So getting that around the state, setting up, running through some scenarios in case we are going to be involved in testing. So we'd set up tents. We have already learned how to bring contaminated folks from a contaminated environment into a clean environment. So these are skills that we've learned, throughout our regular missions that we're applying to the COVID-19 scenario. So that's what we're doing right now throughout the state, making sure that people are safe, that they have the equipment that they need, and that we are ready to respond when called upon.
Well, and we thank you for your service and the valuable role that you guys play. We're talking today, of course, about suicide prevention. Let's dive into that. I mean, is it an extremely stressful time for some of your soldiers? Is the risk of suicide, are you concerned about that right now?
So we are. I mean, if somebody is already thinking that their life doesn't matter, and then on top of that, society is telling them they're not essential, then they send them home. And then on top of that, they're not getting paid. That for us is a perfect storm to cause somebody to, make that decision to end their life. And so we're taking steps to mitigate that as much as possible. We talk about resiliency all the time in the military. We train suicide prevention in every one of our units throughout the state. So now we're just really putting our training, that type of training, into practice as well. How do you mitigate, an unforeseen calamity around the state, around the world, and then help someone who's having those thoughts have enough trust in the system to reach out and get the care that they need in this very difficult time.
As I understand it, the state of South Carolina is really a leader, in terms of suicide prevention and creating, your position. This is your role. You're dedicated to this. What else are you guys doing in partnership with LivingWorks to help protect your soldiers?
So, we've had a very long history of partnering with LivingWorks. They have very good training, the military, we like order and we like a discipline in training, and LivingWorks offers that. And so we've already trained even before this, right? So it took years to make this happen, but we have a total of over 2,000 service members trained in Assist right now. We have hundreds trained in Safe Talk. And now LivingWorks launched Start last year, which is online training for suicide prevention. So right in a very timely place where we cannot do training person to person right now for fear of spreading, this disease, this infection around. We have an online version provided by LivingWorks that we can send to our soldiers, to their families, to our community partners, the Veterans Administration, the Department of Mental Health, to train in suicide prevention where, sometimes we didn't really know exactly how we were going to use it, but this has given us an opportunity to continue along with our training in a way that was unforeseen, just a month ago.
Yeah, because those face-to-face workshops can't happen. We are very lucky, all of us, I think, to have access to Start. You're right. Can you tell us a little bit? At LivingWorks, we talk a lot about creating a network of safety, within a community, whether it's at work or in your family, or maybe it's, within the education system. Let's talk about the network of safety that you guys have been able to build within the National Guard in South Carolina.
Right. So, by being a National Guard, you are a reserve force. So you're not wearing the uniform, you're not on duty 24/7, as opposed to if you were active duty component. So we don't see our soldiers and families on a daily basis. We see them one time a month over a weekend, maybe a couple of weeks in the summertime, but we really don't have a lot of connection with them. So we have to rely on the local community to kind of be that safety net for them when we're not near them. So one way that we do that is we've partnered with the Department of Mental Health around the state, which they just stood up this past year, an Office of Suicide Prevention, which is huge. We have the Veterans Administration in our state that we've partnered with. We do have partnership with the active duty component and the Army Reserve component. So all of these have this network, this net across the state that catches our soldiers when we cannot be with them, or at least that's the hope. We did recently have an experience where that actually worked. We had a soldier in the upstate of this, I'm in the middle of the state. We had a soldier in the upstate that was struggling, and he went into a local, Army hospital. The person that was working there had connections inside of our network, already knew me, knew the Veterans Administration. So they were able to not only help the soldier, there with treatment, but they were also able to connect them to this network that we already had in the state to build this safety network around the soldier to help them feel more supported and basically be safer from suicide.
Chris, we know there's been a stigma, about talking about having, challenges with your mental health, or that maybe you've been thinking about suicide. It exists everywhere. Is
Right.
it particularly acute in the military with soldiers?
Well, it is. So when you have first responders and, those in the military, there's a persona that we show the world, a persona of strength, of being able to be self-sufficient, of being ready at all times. And so if I had a broken leg, I would go to the doctor. Hopefully I wouldn't walk around on it because it would not heal properly. That seems normal. But whenever somebody is struggling with thoughts inside their mind that nobody can see on the outside, the tendency is to not talk about it because you don't want to break that persona that the public has and their family has and their coworker, has looking at them. You want to keep projecting this readiness to the world. But we don't always do that, so we don't talk about it.
Do you think it's getting better?
So it is. So I came in at 88. We didn't have all the resources that we have now. We didn't have suicide prevention personnel around the state. We didn't have, even though LivingWorks was in existence, we didn't have it embedded in our units the way we do now. So the tendency now is to reach out for that help that they need. They feel more comfortable because it's talked about. When you hear your first sergeant or your commander talking about the resources, then you feel it's okay to reach out to those resources. And when your buddies give testimony to, they reached out to these resources, they got the help that they need, and they're still in the military, that backs up what we're teaching them is that it's not a career ender to go get help. If you're hurt physically, we want you to get the treatment that you need. So if you're hurt mentally, we want you to get that same treatment. We want you to be ready. There's no such thing as a perfect soldier out there. Although we want to feel that we're all invincible, that's just not the case. We all have struggles.
Absolutely. And like you were saying earlier, we wish we tracked all the success stories. We seem to have numbers for when things go wrong and we lose a soldier, but there's a lot of success stories and positive ones out there too.
Right.
All right. Anything else that I didn't ask, Chris, that you think is really important or that you want to say to folks out there?
Well, what we, teach every single day, we want folks in the military and outside of the military. We have service members who lose family members to suicide. We have service members who lose children to suicide. So the message that we always preach is that if you or somebody that is having thoughts of suicide, or you suspect that they're struggling in any way, help them get the care that they need by being that support for them.
Absolutely. And it's okay to ask the question, are you thinking about suicide?
Absolutely. Yeah.
Listen, we're going to let you go and get back to work.
Okay.
You're doing important stuff down there, and we really appreciate your time and your efforts of all of the soldiers. Thank you, Chris, for joining us.
Thanks for having me.
Bye now.